All right, welcome back. Austria, the government there is now ordering a lockdown of all unvaccinated people. They say this will help contain the spread of the coronavirus. We told you about the lockdown in Austria affecting 2 million people. All unvaccinated folks older than 12 will not be allowed to leave their homes except to go to work or grocery shopping or to get their COVID shots. Here at home, the Delta variant continues to account for almost all of the cases we've seen of COVID recently. With the incoming winter months, we are also expecting to see more of these cases. Speaking of which, New Mexico and Vermont, hospitals are running out of beds there despite the state's high vaccination rate. Some health experts believe that the rise of cases, especially among the vaccinated, is due to waning immunity as months have passed since Americans received their second dose. Joining us now to talk more about this is Dr. Frank Contanessa. He's an internist at Northwell Health. Dr. Frank, I appreciate you letting us call you Dr. Frank. Thanks for joining us.
Thanks for having me. I know my name can be a little bit long. That's all right.
I also think bedside manner is important, and I'm always humbled, I guess, by having the opportunity to spend about 5 minutes with a doctor, because not a lot of patients get that kind of FaceTime with a practicing physician. So in Austria, we're seeing this lockdown only of unvaccinated people, but we also hear about vaccinated people getting breakout cases of COVID, not experiencing symptoms. So then theoretically, they could be walking around spreading the disease as well. Do you think this lockdown is more of a punitive measure to get people motivated to get vaccinated, or do you think it actually is going to cut down on cases?
You know, I agree with you. I think that it could be a punitive measure. I don't really see the logic in locking down people who are unvaccinated. You know, the Lancet study that came out about a week and a half ago kind of proved to us that vaccinated people and unvaccinated people have similar viral loads in their noses, meaning they're carrying around about the same amount of virus when they're either symptomatic or even asymptomatic. So that means that vaccinated people and unvaccinated people can get and spread COVID pretty much as easily as an unvaccinated person can. So it kind of makes the lockdowns seem a little bit counterintuitive and not very productive. So it might be a measure to try to force people into getting more vaccines. Austria, out of all the Western European countries, has a relatively low level of vaccination. And, you know, the whole story really changed with the advent of the Delta variant. Leading up to that, it seemed that the vaccine was fairly effective, or the vaccines were fairly effective at preventing cases in general. But now we're seeing that that's not the case at all. Most of the cases that we're getting now are breakthrough cases because we have a fairly good vaccination rate. I live in a community with a fairly high vaccination rate. So every case I get is essentially a breakthrough case.
Is there an ability, a need maybe to kind of rework these vaccines? We don't hear much talk about that as well. We just hear get the vaccine, but we don't hear about what additional research is done to, you know, update these vaccines.
I think that it's going to be needed to be updated because, you know, the vaccines that we're seeing now, they're still pretty good at protecting from serious illness and death. So we really need to focus on, you know, attacking the at-risk population, making sure that they're protected. But there is going to have to be some tweaking to the vaccines. There's also some therapeutics on the horizon now that hopefully in the next few months we should be seeing, because right now we have very little in our arsenal as far as therapeutics. So that's going to change the game a little bit too.
Another thing I wanted to ask you about, Israel is set to vaccinate kids 5 to 11 years old. The FDA has just passed the vaccine here for kids of that same age. You know, what does this do to knock down the virus? I mean, we hear so much from the administration that the supply chain crisis, inflation, that's not going to really get better until the pandemic ends. Yeah. But we don't see any end to the pandemic.
Well, I think it's going to do very little to slow the pandemic because children, as we've seen, are not terribly good reservoirs. They don't get it efficiently. They don't really spread it efficiently. And their risk of dying of COVID is pretty close to zero. The mortality for COVID is pretty close to that of the seasonal flu. So vaccinating kids, I'm not convinced yet of the risk-benefit ratio that it really is in favor of vaccinating kids. They're really our lowest risk population. There is every chance that the vaccine is probably safe for kids, but there's no follow-up data. The Pfizer study that was presented was very small. It only had about 2,000 patients in it, and the follow-up was about 2 months. You usually see much larger studies for about 5 years for a vaccine of this magnitude. So we're talking about vaccinating 35 million American kids with a vaccine we tracked for 2 months, and we decided, okay, it's safe now.
Yeah.
And I'm not convinced yet. You know, if COVID was hitting kids hard, if COVID was killing kids, God forbid, or putting kids in the hospital at a high rate, I'd say, you know what? The benefit of protecting them from this terrible illness probably outweighs the risk. But I'm not seeing that now.
Yeah, and that's why you hear from so many parents kind of weighing the facts here, trying to figure out what makes the most sense for their kids. Without these long-term studies with limited impact on this population, it's hard to justify it. Great to see you, Dr. Frank Contessessa. We appreciate your time and look forward to having you back with us.
John, thanks for having me. Thank you.